Bile duct cancer and colon cancer. Bile duct cancer is a type of cancer that starts in the bile ducts, which are tubes that carry bile from the liver to the gallbladder and small intestine. The bile duct system. Intrahepatic bile ducts. These are small ducts that carry bile from the liver cells to larger ducts. Extrahepatic bile ducts. These are the larger ducts that connect the intrahepatic bile ducts to the gallbladder and small intestine. What causes bile duct cancer? The exact cause of bile duct cancer is unknown. However, several risk factors have been linked to an increased risk of the disease. Age. The risk of bile duct cancer increases with age, particularly in people over 65. What causes bile duct cancer? Obesity. Obesity is a significant risk factor for many types of cancer, including bile duct cancer. Hepatitis. Chronic hepatitis, especially hepatitis B and C, can increase the risk of bile duct cancer. What causes bile duct cancer? Family history of bile duct cancer. If you have a family member with bile duct cancer, your risk of developing the disease is higher. Cirrhosis. Cirrhosis is a chronic liver disease that can increase the risk of bile duct cancer. Diabetes. Diabetes is a risk factor linked to bile duct cancer. What causes bile duct cancer? Ulcerative colitis. Chronic ulcerative colitis can also increase the risk of bile duct cancer. Primary sclerosing cholangitis. This is an autoimmune disease that damages the bile ducts, leading to scarring and an increased risk of bile duct cancer. What causes bile duct cancer? Bile duct cysts. Bile duct cysts may be a sign of cancer or can turn cancerous over time. Bile duct infections. Bile duct infections in people with a history of typhoid fever can increase the risk of bile duct cancer. What causes bile duct cancer? Exposure to toxic chemicals. Exposure to chemicals like dioxins, nitrosamines, polychlorinated biphenyls (PCBs), and asbestos can increase the risk of bile duct cancer. Symptoms of bile duct cancer. Jaundice. Jaundice is a common sign of bile duct cancer, occurring when bile cannot flow into the intestine. Itching. Itching is also a common symptom of bile duct cancer. Abdominal pain. Pain in the upper abdomen or right side of the abdomen. Weight loss. Unexplained weight loss. Symptoms of bile duct cancer. Fatigue. Feeling tired and weak. Fever. Fever of unknown origin. Nausea and vomiting. Nausea and vomiting can occur when bile duct cancer blocks the bile duct. Diagnosing bile duct cancer. Physical exam. The doctor will ask about your medical history, perform a physical exam, and assess your symptoms. Blood tests. Blood tests can help determine the levels of bilirubin and liver enzymes in the blood. Ultrasound. Ultrasound can help visualize the bile ducts and detect any abnormalities. Diagnosing bile duct cancer. CT scan. CT scans can provide detailed images of the liver, bile ducts, and surrounding organs. MRI. MRI can also provide detailed images of the liver, bile ducts, and surrounding organs. Diagnosing bile duct cancer. Biopsy. A biopsy is the most accurate way to diagnose bile duct cancer. The doctor will take a small sample of tissue from the bile duct to examine under a microscope. Treating bile duct cancer. Treatment for bile duct cancer depends on the stage of the disease, the patient's overall health, and other factors. Surgery. Surgery is the primary treatment option for early-stage bile duct cancer. Surgery may involve removing part or all of the bile duct, liver, gallbladder, or surrounding organs. Treating bile duct cancer. Chemotherapy. Chemotherapy is a treatment that uses drugs to kill cancer cells. Radiation therapy. Radiation therapy is a treatment that uses high-energy rays to kill cancer cells. Supportive care. Supportive care can help relieve the symptoms of bile duct cancer and improve quality of life. Preventing bile duct cancer. Avoid exposure to toxic chemicals. Limit exposure to chemicals such as dioxins, nitrosamines, PCBs, and asbestos. Get vaccinated against hepatitis B and C. Hepatitis B and C vaccines can help prevent hepatitis and reduce the risk of bile duct cancer. Preventing bile duct cancer. Eat a healthy diet. Eat a balanced diet, limiting fatty, sugary, and salty foods. Exercise regularly. Regular exercise can help maintain overall health and reduce the risk of bile duct cancer. Quit smoking. Smoking is a risk factor for many types of cancer, including bile duct cancer. Preventing bile duct cancer. Get regular checkups. Annual checkups can help detect bile duct cancer early and increase the chances of successful treatment. Note: the information in this article is for general knowledge and does not replace medical advice. If you have any symptoms related to bile duct cancer, see a doctor for advice and timely treatment. Remember that early detection of bile duct cancer is key to successful treatment. Note: colon cancer is another common type of gastrointestinal cancer that occurs when cancerous cells develop abnormally in the lining of the colon. Most colon tumors start from colon polyps, which are small, non-cancerous growths that can turn cancerous over time. Risk factors for colon cancer. Age. The risk of colon cancer increases with age, particularly in people over 50. Family history of colon cancer. If you have a family member with colon cancer, your risk of developing the disease is higher. Risk factors for colon cancer. Diet. A diet low in fiber and high in saturated fat and red meat can increase the risk of colon cancer. Obesity. Obesity is a significant risk factor for colon cancer. Lack of physical activity. Lack of physical activity can increase the risk of colon cancer. Risk factors for colon cancer. Smoking. Smoking is a risk factor for colon cancer. Diabetes. Diabetes is a risk factor linked to colon cancer. Inflammatory bowel disease. Inflammatory bowel diseases, such as ulcerative colitis and Crohn's disease, can increase the risk of colon cancer. Risk factors for colon cancer. Colon polyps. Colon polyps are small, non-cancerous growths that can turn cancerous over time. History of small bowel cancer. A history of small bowel cancer can increase the risk of colon cancer. Symptoms of colon cancer. Change in bowel habits. Diarrhea, constipation, or changes in the frequency and consistency of stools. Blood in the stool. Blood in the stool may appear as fresh blood or black stools. Abdominal pain. Pain in the lower abdomen, or a feeling of persistent abdominal pain. Symptoms of colon cancer. Weight loss. Unexplained weight loss. Fatigue. Feeling tired and weak. Nausea and vomiting. Nausea and vomiting can occur when a tumor blocks the intestines. Bloating. Feeling bloated or gassy. Anemia. Anemia can occur due to blood loss in the intestine. Diagnosing colon cancer. Physical exam. The doctor will ask about your medical history, perform a physical exam, and assess your symptoms. Blood tests. Blood tests can help determine the level of hemoglobin and detect any abnormalities. Diagnosing colon cancer. Colonoscopy. A colonoscopy is a procedure that allows the doctor to directly examine the colon using a scope. Biopsy. A biopsy is the most accurate way to diagnose colon cancer. The doctor will take a small sample of tissue from the colon to examine under a microscope. Diagnosing colon cancer. CT scan. CT scans can help visualize the colon and detect any abnormalities. MRI. MRI can also provide detailed images of the colon and surrounding organs. Treating colon cancer. Surgery. Surgery is the primary treatment option for colon cancer. Surgery may involve removing part or all of the colon. Chemotherapy. Chemotherapy is a treatment that uses drugs to kill cancer cells. Radiation therapy. Radiation therapy is a treatment that uses high-energy rays to kill cancer cells. Treating colon cancer. Supportive care. Supportive care can help relieve the symptoms of colon cancer and improve quality of life. Preventing colon cancer. Eat a healthy diet. Eat plenty of fruits, vegetables, whole grains, and limit red meat, saturated fat, and sugar. Exercise regularly. Regular exercise can help maintain overall health and reduce the risk of colon cancer. Quit smoking. Smoking is a risk factor for colon cancer. Preventing colon cancer. Get regular checkups. Annual checkups can help detect colon cancer early and increase the chances of successful treatment. Get regular colonoscopies. Regular colonoscopies can help detect colon polyps early and remove them before they become cancerous. Preventing colon cancer. Get regular fecal occult blood tests. Regular fecal occult blood tests can help detect colon cancer early. Note: the information in this article is for general knowledge and does not replace medical advice. If you have any symptoms related to colon cancer, see a doctor for advice and timely treatment. Remember that early detection of colon cancer is key to successful treatment. In conclusion, In conclusion, bile duct cancer and colon cancer are two common types of gastrointestinal cancers. Understanding the risk factors, symptoms, diagnosis, and treatment is crucial for preventing and treating these diseases timely. Remember that taking care of your health and maintaining a healthy lifestyle plays a vital role in reducing your risk of developing cancer.